Hello, everyone. Good afternoon. I'm pleased to welcome Ms. Mickal Lewis, MPH CHW, who is a U.S. Army veteran. She is the Associate Director for the Center of Excellence at the Alzheimer's Association. She manages daily grant activities for the BOLD Public Health Center of Excellence on Dementia Risk Reduction, collaborates with scientific partners to turn evidence into public health interventions, and develops resources for the state, local, territorial, and tribal public health agencies. Mickal also oversees dissemination, capacity building, and progress measurement of these initiatives. Throughout her career, Mickal has developed programs to improve health equity, community health, social determinants of health, and advocacy for minority and diverse populations. She is dedicated to advancing dementia risk reduction and promoting healthier, more resilient communities. We are so happy to have you here, Ms. Lewis, and platform is all yours. Thank you.
Awesome, and thank you so much. Hearing you give my bio is always nice to hear. It's a great reminder of the great work that we're doing here, not only at the association, but just in the community as well. So I wanted to introduce myself. I'm Mickal Lewis. I'm the Associate Director specifically for the Public Health Center of Excellence on Dementia Risk Reduction at the Alzheimer's Association. And just a brief pause here is that we like to highlight that the vision of the association is a world without Alzheimer's and all other dementias. And one of the great things I would like to just share is that today's presentation is funded through the CDC Cooperative Agreement. So a lot of the slides that we have, I can share, but they will be in PDF format. But I wanted to briefly pause here and just highlight what dementia is. So dementia is an umbrella term, and it is defined as an impairment in two or more cognitive functions that interfere with activities of daily living. However, Alzheimer's is the most common cause, as you can see through the teardrop starting from the left to the right, as well as at the bottom, there is mixed dementia, which is very prevalent, and some causes of cognitive decline are reversible and not truly dementia. So we like to just show all of these examples and then highlight some of the ways that you can not only help, but also spread the word about Alzheimer's, dementia, and brain health. So just briefly, how can you help? We have our 24/7 helpline, which is available in over 200 languages, but it's also open around the clock 24/7, and it's confidential. You get to speak with a master level clinician, not only if you're a person living with dementia, but also a caregiver and families who may be caring or living with someone with Alzheimer's and dementia. And we also have our free curriculum or our education through our alz.org website. And then lastly, our Alzheimer's Association and AARP Community Resource Finder. If you like, I can drop those in the chat. It just may take me a brief moment. And then if not, and you're unable to capture anything just from today's discussion, I'm happy to send these resources over as well in my follow-up email. But here we like to just show that there is an urgent need for brain health promotion. As you can see on the graphic, starting at the bottom, you see 2025 at 7.2 million of Americans age 65 and older living with Alzheimer's. And you can see that that projection is expected to increase by 2060. So this is one of our call to actions that we like to say is we need to start incorporating brain health into existing chronic disease programs. We're not asking you to reinvent the wheel. We're just asking you to keep us as a part of the conversation. But just a brief highlight on how the Dementia Risk Reduction Center came to be. In 2018, Congress passed the Building Our Largest Dementia BOLD, for short, Infrastructure for Alzheimer's Act that expands the public health efforts to address cognitive health and Alzheimer's. And that includes the Dementia Risk Reduction Center, housed at the Alzheimer's Association, the Early Detection Center, housed at NYU School of Medicine, and then the Dementia Caregiving Center, housed at the University of Minnesota. And we all three partner together as part of the HBI Collaborative, along with additional national partners as well, to make sure that we're all talking about brain health and Alzheimer's, and we're really advocating for our constituents. And just to show you that we are a powerful team of 3 at the Risk Reduction Center, but we are a team of 12 as part of the public health team. So my leadership who was unable to join us today is Shelby Roberts, along with my colleague, Kat Holcomb, who really helps with managing the projects in our webinar series. So I always like to give them a brief shout out. But what we do at the Risk Reduction Center is we review the latest scientific evidence. We translate the evidence into public health action, specifically for state, local, tribal, and territorial public health agencies. And then we work with those public health agencies to put that work into practice. So what does that look like? A few of you may be familiar with this graphic, but you may not have seen the healthy cognitive functioning along the prevention spectrum. So specifically for risk reduction, we are that top line where we focus on that primary prevention. And as you can see, comparatively to the healthy cognitive functioning, is that it does go all the way up to moderate dementia. And this is where we like to say that there's an opportunity to start having that conversation and incorporating brain health into the work, because there are opportunities to reduce someone's risk for dementia and Alzheimer's. But just a brief pause here if you have some time or just want to throw something in the chat. How are some public health professionals ourselves, how are we integrating risk reduction messaging into practice for younger generations or younger audiences? And for a brief example, I'll share that in Georgia, they are working on not only teaching kids how to cook, but also what to shop for when they're helping their parents on shopping. So there's always little ways to include our younger generations, 18 and under, specifically on how to not only talk about brain health, but how to live a well, full life. And as a public health professional, I like to give everyone one or two options. So no matter which intervention level or spectrum or socio-ecological model you decide to focus on, or your area of expertise, there are opportunities, as you can see on the graphics, to incorporate brain health discussion, Alzheimer's and dementia into your existing work. And a lot of our work does align with the Healthy Brain Initiative roadmap framework. So on that outer ring, you'll see the risk reduction, which focuses on encouraging public health to promote brain health for from early life through older adult. You'll also see on the right side that early detection and diagnosis, which focuses on supporting efforts to increase that awareness and access to cognitive screening and diagnostic services, as well as public education to normalize conversations and memory concerns, or about memory concerns. And then towards caregiving, that focuses more on the safety and quality of care. So although a caregiver is caring for a person living with dementia or Alzheimer's, we also want to make sure that they're taking care of themselves, and we are providing them the resources to not only advocate for themselves, but the person they are caring for. And then lastly, the clinical and community linkages, which really strengthens that connection between that clinical provider and the community-based support, and then helping promote that development of the systems that help navigate care and services. And then looking at the inside of the circle, you can see that the middle piece, it says health equity, but that can change depending on what your focus is in your community. For strengthening partnerships and policies, of course, that's embedding brain health into existing work, as I've said a few times. Measuring and evaluating and utilizing data. So how are we capturing data? How is that getting out to the community so they can use that data to not only show the work that's being done, but also advocate for funding? And then there's the building a diverse and skilled workforce, encouraging collaboration amongst public health agencies, healthcare, social workers, all professionals that really drive this work. But also being able to advocate for them to be fair wages. And then lastly, just engaging and educating the public. So is the materials that we're putting out into the communities culturally as well as linguistically appropriate for the community that we are bringing this information to? And if there's a way that we could adapt just based on language as well as the community. So I'll nice little brief pause before we go into the state of the science. A lot of the time we talk about these modifiable risk factors for dementia, and not a lot of people get to see what that looks like. So on the screen, you'll see that there's about 14 to 20 of the risk factors that we are currently monitoring at the association. However, you'll see in the teal bar that says the 10 factors with the strongest evidence. Those are our 10 healthy habits that we promote, which is appropriate for all communities, no matter race, ethnicity, age. We talk about the formal education, TBI, midlife hypertension and obesity, diabetes, physical activity, smoking, sleep, balanced nutrition, and cognitive engagement. And one of the things was we originally started off with 364 of these risk factors. And in collaboration with Wake Forest University School of Medicine, we were able to trim that list down to the top 10 with the strongest amount of research to be able to advocate for these risk factors and healthy habits. So you'll hear me throughout the presentation use them interchangeably. So if I say risk factors, I'm referring to the healthy habits unless I specify otherwise. This is our campaign, our messaging campaign for the 10 healthy habits. But just to go into a deeper dive, we like to put control your blood pressure and manage diabetes together. So this might look like working with your medical provider to manage your blood pressure, likewise with diabetes, but also being cognizant of increasing that physical activity component, eating healthier, as well as just being outside, being active. And you'll also see on the next slide, get moving and eating right. Again, you've probably heard all of these resources before, but it's just with lifestyle fatigue, I just ask that you take one of these risk factors or healthy habits to incorporate by Christmas. And then as you're moving forward through the additional risk factors, if there's another one you would like to focus on, feel free to add that to your list as well. And then maintaining a healthy weight as well as sleep. We like to advocate that sleep 7 to 9 hours, just depending on gender. I don't believe that we specifically say if it's 7 or 8 hours for women, especially since research has shown that women need more hours of sleep than men may need. However, depending on your schedule and your lifestyle, adjust that as best as you can. Likewise, with maintaining a healthy weight, we do ask that you work with a healthcare provider and what works best for you. And then next, we like to say be smoke-free. We don't like to tell people to quit, even if it is recommended, but be smoke-free. That gives them that option and that behavior change to be able to correct their risk factors, as well as protecting your head. This might look different for each individual community. So protecting your head for children may be wearing your helmet while riding a bike or playing sports. But for adults, this might be having handlebars in the shower to help you get in and out of the shower, as well as holding on to the bar as you're going up and down the stairs to prevent falls. So a few options. And then lastly, we like to stay in school and challenge your mind. And this, again, looks different for everyone. So staying in school for the younger generation or younger audience might look like graduating high school, making it through middle school. For older adults, this might be either a certification or attending a library resource fair where they are being taught how to use a cell phone or how to type quickly. And then challenging your mind, learning a new skill. So whatever that new skill looks like for you, I like to play Sudoku for myself. However, I know that if I've mastered Sudoku, I need to find something else that may challenge my mind. So I like to recommend that you just do something that keeps your brain working. It's like a muscle. You want to stretch it as best as you can. And then one of the great things I would like to highlight is the Alzheimer's Association US study to protect brain health through lifestyle intervention to reduce risk, which is long for US Pointer. We recently concluded this 2-year clinical trial to evaluate whether lifestyle interventions that simultaneously target many risk factors protect cognitive function in older adults who are at increased risk for cognitive decline. And one of the great things I would like to share is that the results showed were positive for both clinical trials. across 5 sites, and we had over 2,000 participants, whether it was self-guided or structured, over the past 2 years. But looking at from a public health perspective and translating that study to the community, we'd like to say that we're no longer just knowing the modifiable risk factors protects your brain health. We now have research that shows that intervention addressing these risk factors actually work for cognition. And previously, I did share that this works for all communities and all populations. That is still true. And really, the message that we're asking is that everyone spread the word about US Pointer recipe, and I can drop the link to that recipe card in the chat. But really just helping us share these healthy habits, these risk factors to really promote healthy brain living. There we go. I was able to drop that in the chat. And then, of course, this also is an opportunity for us to emphasize and strengthen our cases for increased funding around dementia and Alzheimer's as a public health priority. So this is some of that data that we like to highlight. And then to circle it all back together on everything I just shared, it's all connected. So whether you're addressing heart health, social engagement, cognitive stimulation, physical activity, nutrition, as well as access to education, it's all connected, and we're all working towards living a better, healthier life. But one of the things that we at the center are really promoting and pushing for is to reach that younger generation as well. So how can we bring the younger generations into the conversations, especially when you're looking at the intergenerational households and more family members living together? Bringing the messaging of hope and empowerment, making sure that we're empowering our community, as well as meeting them where they are and leaving that door open as we're navigating through the communities to be sure they know who to reach out to or who to contact for resources. And then lastly, just recognizing that we can't do everything by ourselves. We have to partner with other agencies, communities, populations, people to really make sure this work is being heard and seen. And if anyone is like me and you're asking, what do I do? What does this look like? I'll show you a brief overview of some of the resources we produce. So first, specifically for Utah, we do have our state health overview pages, which provide the risk reduction or the risk factors for cognitive decline. And I put up the Utah one specifically just to showcase how we're highlighting the data that we're acquiring from the BRFSS, which is the Behavioral Factor Surveillance System. And we're also highlighting how it factors across the races or ethnicities as well, because there are people living with at least one of the 5 risk factors. And those risk factors include hypertension, diabetes, obesity, smoking, sleep, and physical inactivity. And it's those 6 that are reported by the states, so they're easier to track. But on the right side of the screen, you can also see how in diabetes in Utah, it's a little darker towards the outer cities into the rural areas. However, on this next slide, you'll see now looking at obesity compared to sleep, is that some of the counties closest to sleep, to the big cities, they're not getting much sleep. They're actually getting less sleep comparatively to some of the outer counties in the state. But also looking at obesity, how there's darker spots on the screen. So those are opportunities to bring obesity discussion and nutrition into those communities. And then also asking for their feedback. Like, hey, do you even want to hear about this? What's causing a barrier or a challenge? And really just seeing what the community would like to see. And again, just reiterating, how can we all help as professionals? For public health action on brain health, we do have our 10 Healthy Habits campaign, and that is on our 10 Healthy Habits website. We also have a brain health messaging toolkit coming out this fall, and you can always sign up for our public health e-news to be notified when that will be coming out. But we recently updated our modifiable risk factors, and those risk factor summaries actually just highlight what do we know, the public health implications, as well as the role of social determinants of health in those summaries. And that really just promotes that awareness, that lifestyle, health behavior, as well as to help the communities reduce their risk for cognitive decline. But if you work with health departments, there's also additional resources such as our community convenings toolkit and our social determinants of health toolkit. And the community convening is really where we take the framework and implement it into the community. So we just ask that the health department, as alongside our Alzheimer's Association chapter, bring all of the community partners together and talk about the 10 risk factors or the 10 healthy habits, and then fine tuning and reducing down to maybe one or two of those risk factors that you would like to focus on for the next year, or in continuing to build up into including the additional healthy habits. And then lastly, the social determinants of health really looks at how to identify and address dementia-related social determinants of health. And we also have really great case studies in each of these toolkits and resources. But for public health professionals, we do have additional resources. So if you like CEUs, we have our public health curriculum. We just received our CHES CEUs, but we also have our upcoming public health and dementia risk reduction, as well as the early detection of dementia public health curriculum coming out. So these were done in partnership with the 3 centers. As you can see, we also have our dementia care and navigation training series, which I think is a really great learning opportunity as a CHW, a community health worker. We don't really get a lot of CEUs in programs, but to learn about dementia and navigating that space as a community health worker, I think the dementia care navigation training has been one of the great resources to really help someone navigate that area of expertise. And then lastly, we have our modifiable risk factors for dementia micro learning series. And you can see that it does highlight those 10 healthy habits that I previously mentioned. And I'll be sure to just drop in the chat not only the resources, but we do have our upcoming curriculum webinar, and would be happy if you all were able to join. And just reiterating, our call center, it is open 24/7. So please share this resource out. If there are any local resources that you may need, please feel free to connect with me. I'll give you my contact information towards the end. We're happy to work with you all to get some resources to you. And then last but not least, you may have heard me mention the public health e-news. So through this e-news, we share our newest toolkits, our upcoming curriculums, if we revamp some of our science summaries and infographics, as well as our modifiable risk factor videos and additional programs. We would love to have you join us. I think we've met our milestone of 10,000 subscribers. So it's always great to make sure that we're not only sharing public health information, but also brain health and Alzheimer's and dementia information as well. And here I will say thank you so much. And if you have any questions, feel free. I think we're okay to hop off mute if that's okay. But if not, I'm happy to stay on and answer any questions.
Thank you very much, Ms. Lewis, for such a wonderful presentation and lots of resources. I made sure I saved all of it and will share with our students and our partners. If anyone has any questions, please feel free to unmute and go ahead.
And thank you for capturing those links. I can also send the slides as well as the resources in the notes section as well, if that's a little easier.
Oh, that would be great. Thank you.
No problem.
Tatiana, would you like to say something?
Yes, I love your website. It has so many resources, not just for patients, but also for their caregivers. That's amazing. And in many languages. So I really appreciate it, and I feel it's worth for all of us to visit and explore a little bit of what you guys have offered. Thank you so much. This was very educational. And we will be posting it on our YouTube so that many other students can take advantage and learn from this presentation.
Thank you so much, Tatiana. And that's a great point. So we do offer the 10 healthy habits in English, Spanish, Korean, Chinese. I believe we're working on Haitian Creole right now, but I think that's it. Unless Raven, you can think of one I may have overlooked.
You covered what I know of.
Perfect. Thank you.
Did you say you can do presentations like this for other venues, right? If the students wanted to bring you into their own programs?
Yes. So I typically don't do these programs. It's actually my leadership, Shelby. She was just out today. However, depending on if it's a local in-person presentation, I'll work with the local chapters, such as Raven, who's in Utah, as well as depending on the locations of your students. I'm not sure if they're in person or online, but we can definitely work with the local chapters as well to give these brain health presentations.
Wonderful. Thank you so much.
And I'll go ahead and throw in this caveat. If any of the students would like to connect with me on LinkedIn after watching the recording, please do so. I'll also drop my email when I send the follow-up email, so that way that can be shared as well, and they can email me one-on-one.
Excellent. Thank you so much.